viewers, welcome to the maiden edition of your Q Health program coming on QTV with me, Aliou Cissé. And in today's edition, I have a renowned medical doctor, Dr. Abubacarr Jah, who is also going to be my main resource person in this weekly program coming every Wednesday on this channel. Dr. Jah, welcome to the program.
I'm very happy to be on this program.
Well, Dr. Jah, today we're going to talk about how the body works. Can you take us through?
Just to introduce myself to the viewers, I am Abubacarr Jah. I'm a Gambian doctor and have been working in the country for the past 13, 14 years as a medical doctor. I work as a lecturer in the university, in the teaching hospital of the only teaching hospital of the country. I also work in Edward Francis Small Teaching Hospital as a consultant urologist. During the program, I will explain to you what a consultant urologist means. And also, I am the medical director of a private clinic called Sharab Medical Center. And I'm very happy with the introduction of this program because it is really very important that our population learns more about their health, becomes more health conscious, so that we can have a healthier nation and a wealthier nation, as they say. The program, as we said, really aims just to educate. We do not aim to treat people on the program itself, but we just aim to educate people. Now, coming back to your question, which is how the body works, I think that is the beginning of understanding how our health is. Because if we don't know how the normal body functions, then it is really very difficult to understand when there is a problem with the body, what the problem is and how to deal with it. I always explain the functioning of our body just like the earth that we live on, this world that we live on. And the body is exactly a mirror image of how the world is. And I will explain it to you so that you will understand. I mean, we all know that in this world, we have people populating it. Human beings, me, you, everybody else in this room, we're human beings in this world. And these human beings are made up into communities. So you have villages, so some people are from Fas Jaho, some people are from Basse, some people are from other place. We also have tribes. Okay, so you have communities, that is what I call the communities. Then those communities come together to form what? To form countries, isn't it? And those countries come together to form a continent. And those continents now come together to form the world. The same thing you have in the human being. So in the human being, you have something called cells. They're the building blocks of the human being. And they represent exactly what we as people represent on the earth. Meaning that those cells, each one of those cells, like if you look at my hand now, there are already, if you just take this patch here, there are already maybe millions of cells there. The whole human being is formed by people estimated to be trillions, several trillions, 15 trillion cells that make me who I am today. Now, each of those cells is a living thing, living on its own, having a function, eating, just like I'm eating, that cell also needs to eat. That cell lives, that cell dies, okay? So those cells in this area form what we can see now. We cannot see those cells with our naked eyes, but when you use a microscope, you see them, and they function. So those cells form the population. Now, if you see the cells here, and you see the cells here, they are different. They are actually even different in color. And they are cells. These ones are also cells. So this one might be the Mandinka, this one might be the Wolof, but they are different, and they are all cells. Structurally, they are the same. So those cells come together to form communities. So what I mean by the community is the tissue in the body. So that is what we call, scientifically we call it tissue. So that the skin tissue is a different community. The nail tissue is a different community. Okay, and they do different things. You know that here, for instance, the Serers, they are known to be fishermen. Okay, the Mandinkas are known to be farmers. The Pulas are known to be herdsmen. So they're different things. The same thing here also. The nail has different function. It has many cells inside it. The skin has different function. So that's the tissue. Now the tissue comes together to form an organ. Okay. Now the organ, for instance, the whole skin of the body is considered to be one organ. The eye is an organ. Okay. The heart in my chest is an organ. The liver in my tummy is an organ. Okay. There are many cells, different tissues that come together to form that organ. In the liver, for instance, you'll have blood cells there. You'll have the liver tissue cells themselves. You'll have the nerve cells themselves. There are different tribes, so to say, different communities coming together to form one organ. That organ represents what? A country. So you have different countries. Then you will also have different organs coming together to form a system in the body. Like now, in the chest, that is what we call the cardiorespiratory system. So that your heart is there to pump blood. Okay, that system contains many different organs. So you can have the heart there is an organ. The aorta, which brings the blood down, is an organ. Okay, the blood vessels that go, so they go together. Then you have the lungs, breathing in air, is an organ. So the heart, the lungs, and all the other tissues that are coming there come together to form the continent. So what systems do we have in our body? We have the cardiorespiratory system, as I have said. You have the gastrointestinal system in your tummy. You have the central nervous system. Okay, and those all come together now to form the human being. Just like the world is formed of people, communities, countries, and so forth, the body also, you can look at it like that. And not only that, the things we have in our world to survive, they are also in the body. Okay? We have road networks in our body. You have the red blood vessels coming from the heart, going to everywhere in the blood. So there are road networks where you transport food to go into the leg. You eat food in your mouth, but the food has to reach your leg so that your leg will survive. If it doesn't reach it, your leg will not survive. So there are road networks in your body where that food goes on. There are transporters. There are some cells that are like transporters. Okay, there are some mechanisms where things are transported, just like we transport them in for instance, trucks here and so forth. So that is happening inside. We have our telecommunication systems also inside the body. Your brain thinks and tells the hand, touch this telephone, and the hand touches this telephone. How did it do it? It did it through a network of nerves, and those nerves also are cells, just like I said. So it is very important to understand that we have a police network inside our body. You have some cells that are for policing. You have some cells that are for defense. You have to, when we go through the program, as we go on the program, we will tell you all this, okay? The program is 30 minutes for now, so we will have to summarize some things. But as we go on, my aim is to make the whole Gambian population understand their body so well that, you know, whenever anything is wrong, they will realize something is wrong and they will know how they are going to deal with it. But basically, in a summary, you can look at your body as the whole world. Every one of us is a world on its own.
Once again, you're watching Q Health on QTV. I am Ali Sise, and on the show today I have Dr. Abubacarr Jah, a renowned medical doctor. Dr. Jah, you've given an overview of how the body works. So meaning, if anyone fails, does enough man's survival?
If any part of those things fail, the parts that I have mentioned in the body, that will affect the whole system. Just like in this world, if there is war somewhere, people tend to think that if there is war in for instance, Syria, it's not going to affect Gambia. It's going to affect Gambia. There will be effects in the same thing in the body. If anything happens in the heart, the whole body will have to respond. that happening that has happened in the heart. But also there are mechanisms to defend yourself against those. Your own body contains its own defense mechanism to try to adapt, to try to, for instance now, if your one kidney, you have two kidneys, one kidney is damaged, the other kidney will adapt by expanding, by making sure that it now performs the necessary function. I think they're calling me in theater now. We may have to go to theater to complete this program and talk about things more there.
Well, viewers, you've heard it from Dr. Jah. We will now move to the theater where he's going to demonstrate most of the things that he has explained to us here. We are here at the theater at Saraf Medical Center in Kanifing, still on the first edition of the Q Health Show with Dr. Jah. You talk about the function of the different parts of the body. What are the possibilities of having a malfunctioning body?
Yes, just like I told you, I mean, it works like the world. And obviously, as you know, the world is not a smooth environment now. There are lots of problems happening around, wars are happening, people are killing each other. We have also, one thing I didn't explain, when I explained to you about how the body works, is that apart from the cells of the body, there are some extraterrestrial or extra non-human cells also in the body. You have the bacteria. So bacteria live in the body, and they are part of the body, and they interact with the body. Some of them are harmful, some of them are harmless. So you can have a situation in which the body itself malfunctions, like the heart, which was functioning, is no longer functioning properly. You can have also a situation in which another animal, not the cell, another type of cell like a bacteria or a virus causing a problem in the body. You can have a highway that is supposed to be a path that is supposed to transport something, and that highway collapses or gets a problem. In fact, the operation I'm going to do now is something like that. You know, the urinary pipe is a pipe where urine is supposed to flow and come out, and all of us pass urine without even thinking 2 times about it. But some people do have problems passing urine because they have a blockage there. So it's just like a road that has been blocked, and it needs to be unblocked so that things can pass through again. And this operation we are going to do is something like that. Okay.
So normally before you go in, you wash your hands?
Yeah, so normally, obviously, you have to wash your hands very well to avoid bacteria coming out from your own body and entering the body of the other person. So you have to wash yourself very well before going in for theater. We were saying, I mean, today the focus of this is not on the operation that we are going to do. During the program, we will have lots of diseases that we'll talk about, and we will be able to focus on the disease itself. But today we are talking about how the body works. And as I said, this particular case that we are doing, it's like malfunctioning of a part of the body. So that can happen. And as I said, it can be infections. Infection meaning that there's an organism from outside coming inside the body and causing havoc in the body. There can also be situations where you got an inflammation, a cancer, for instance, where it is not from outside the body; it's from inside the body. It is the body part itself that has malfunctioned, and then things are not working well. The heart, which is supposed to pump blood, if there is any problem with its valves, then there could be a problem with that. The liver that is supposed to help in the digestion of some of the food particles, if it doesn't work properly, there will be a malfunction. So malfunction can come from outside the body, where you have bacteria coming in the body and causing destruction, just like in the world here also, you can have situation in which you have, for instance, locust infestation in the fields and they destroy all the things. People are talking about extraterrestrial people that can come, mass attack and all that side of stuff. That is happening inside the body. Something from outside coming to cause havoc in the body. But also, you can have situations in which the body itself is destroying itself, just like we are doing in this world. Human beings are killing other human beings, and that can also happen in the body, and we are supposed to sort it out as doctors. One of our work is to sort out all those types of problems. So as I've talked about infection, I've talked about autoimmune diseases, which is the body itself causing it. We've talked about us as human beings also causing problem by eating things that we are not supposed to eat and they harm our body. Okay, so we're going to go on with this procedure now. So if I can have some KY jelly, please. Yeah, good. No need for today. Okay. So basically, even in the treatment of the human being, it's not all surgical treatment, as we said. You can have surgical treatment, you can have medical treatment, you can have physical treatment, where it's only physiotherapy that helps the patient. So once we are going through the program, also we'll be talking about all those things. But treatment is not only one-faceted. I'm a surgeon. Most of the treatment I do are by surgery, but there are medical treatments as well, and other forms of treatment. So you can take medications to solve the problem. In this case, it is like, as I was telling you, it is like the highway is destroyed. Can we get the water flowing? And then press the light. Can we get the, can I get a giving set for this? Don't worry, just press that button there, down, below it. The next one. Yes, that one. That's good. So light is on. Give me a giving set, please. So this is the camera we are using, and we are going to use it to put it in the water pipe, and we'll be able to see inside the water pipe. Now I'm outside. I'm just showing this gauze there here now. But once we get into the water pipe, we'll be able to see how the water pipe looks like. Can we take that TV screen down so that they can see the screen better? The TV screen. Okay. Great. So what is on? Okay, so this man has a very tight, even the inside. Okay, can we have more water flowing? Can we have a pressure on that? A little bit of pressure. Okay, so I can now see the inside of the water pipe. If you look, there are bubbles coming in, but this is the inside of the water pipe. This is like a highway I was talking about. This highway is supposed to transmit urine to come out, okay? And it is normal here. All this is normal. You can see it wide and nice highway, but he has a blockage somewhere, and that is what I am looking for. Can you see how narrow that part is? This part is a little bit narrow. We can still go through it, okay? And that's it. So this is where the prostate is, but it was just a small narrowing that he had. So I was just trying to make sure that we are in the right place here. So that's it. So now this is the prostate. This is normal, but this part is enlarged. You can see that. But we will explain all that in another program. And now you can see a very tight narrowing there. Very tight narrowing. Okay. So can I get a guide wire, please? Can you come this way, Sana? So if you want to look in the screen there, you may see that I'm putting this guide wire here, and that guide wire will go. Can you see the guide wire now in the screen? So this is the guide wire I was putting in on the screen. So you can see a wire going in so that I can find the way, because we can't. So I'm trying to find the way into the bladder because everything seems to be blocked. That's a small stone inside. Can you see the stone? That's a stone inside the bladder. So you can have stones, foreign things inside.
What
This blockage is from infection. So he had an infection, so it's an external thing that caused the blockage. So I'm just trying
So it is actually caused by malfunction of any part of the body?
Yes, it is. It is caused by malfunction. So that stone is causing an obstruction. Okay. Okay, can you get another container? Gelajo. Jamal ñu beneen. So he doesn't have a supercubic there. Okay, that's fine. Okay, busal ma. Jarut nga bona ko, yow busal rek. So all I'm trying to do now is to find a way into the bladder. It is blocked by stones, it is blocked by lots of things. So if we can't find a way, it's always better to just let it be until you do a major operation to do it. This is just a minor thing that we're doing here to try to find a way.
So it might require a major operation?
Oh yeah, this one might require, most likely it will require a major operation. I am almost sure it will require.
But it's curable?
It's curable. We can always cure it. But it's totally blocked. There is no way in. So we're going to abandon this procedure here, and then we'll come back another time and deal with it.
Are such cases common here?
Very common. We deal with it all the time. Some of them were lucky to be successful to get it done. Some of them were not, but this is a very common thing in the Gambia, blockage.
So when you say unsuccessful, does it mean?
What I mean by unsuccessful is that we cannot do it this way. There is endoscopic way and there is open way. So if the block is too much, then what you need to do is to go in and remove where the blockage is. So, you know, just like a road network, that's it for today. Just like a road network, if you go in, if you go in and try to, if it is a small patch that you need to do, you don't need to destroy the whole road. Just like when they were doing stem corner, they had to destroy the whole thing and do it again. In some cases also in surgery, that is what you need to do. In this case also, this is what we need to do. We need to come in, open it up properly, remove all where the blockage is, and then move on, and we'll be able to find a way. Yeah, TURP, we have 2 of them?
One.
Just one TURP. Okay, can I have something for cleaning?
We have 3 optical electrical, 1 is
something for cleaning. So you may incorporate it into this. You know, when we tried to go in and there was no way, then we now say that this is the solution now. It's just like, you know, when the highway is all destroyed, then you can divert.
So maybe when you can just explain.
Yeah, I'll explain.
Now that we're tired before.
Yeah. Yeah, that's it. That's fine. Okay, that's enough. Okay. So, okay, let me just stand. Do you want to stand that way if you want to, yeah? In the endoscopic procedure, we were unable to find a way into the bladder. And all these things you are seeing now here that I am cleaning up, it is actually the enlargement of the bladder. So the bladder is now full of urine and he cannot pass it. And we have looked down to see whether there is any way through the water pipe, which is the highway I was talking about, and there was no way through the water pipe. So what we are going to do is a simple procedure to divert it. So we are going to find another road to go in. And we use special instruments for that. These are all ordered from outside, which we're going to use to put inside his bladder. The patient has already been anesthetized. That means that he doesn't feel any pain. Whatever we do now, he won't feel any pain. Can I get some more gauze, Sana? Okay, good. So we're just going to make a small cut onto his tummy here. He won't feel it because he's not feeling pain now because he's anesthetized. So we made a small cut there. For people who are squirmish, that is a bit difficult to take. Okay. Then we're going to put a needle there into the bladder. Massa. And you can see this is coming out, urine is coming out, which was unable to come out. And we're going to use something called a guide wire. You have a urine bag? A lot of urine coming out.
This one fine.
So the needle comes out. Then we're going to dilate it. Very tight there. Master. So he's not going to feel any pain yet. Okay, so it's just getting diverted. Give me the blade. Like this. Very tough in there. Oops, sorry.
Ready? Anytime. Are you okay? Look at the limb part again.
So you can see urine coming out.
You want saline?
Yeah.
Okay.
Can we have it's a bit tight there. Can I have some KY jelly? So it is inside now. So okay. So now we've diverted the urine to come through there.
Do you really have to master the body parts to know this?
Oh yes, you cannot just do this like this. Not everybody can do this. It can be very dangerous if you don't know where you're going.
Then it's okay.
Yeah, that's it. It's okay, fine. So now all the urine will be coming out through here now. Instead of coming out, you can see a lot of urine in there, which he could not pass before. So that's it. So we clean. Okay, can you just cut this for me? Yeah, that's fine. The blade is here.
So that's going down now.
So that's now going down. The urine is coming out. So this is just to press it up. Okay, and some plaster. That's it.
This is plaster.
So you can see the swelling that was there is now all going down. Huh? Yeah, it's okay. Good. Okay,
So how long will it take?
this now, I will put it there as a diversion. This is just a diversion until we can do the proper operation for him to open up down below. Once we open down below, then the diversion goes out. Then we can remove this, and then he can be normal again. So that is the procedure that we've just done for him. Now these things can be very expensive. Like this set alone is about almost $100
Wow.
just to buy this set. So that's why healthcare can be also very expensive. Okay, that's it, it's done.
Well, viewers, with that we come to the end of this first edition of the Q Health Show with Dr. Abubacarr Jah. He's a renowned medical doctor, and we came to Sarap where we discussed the issue of how the body works, and as you watch, he has taken us through how the body works, and we hope you enjoy the show. Do join us next week on Wednesday at the same time with me, Aliou Cissé. Thanks for watching.